All right, thank you. And while many are excited about the mask mandate lifting, the Minnesota Department of Health warns that we still all need to be very cautious.
Especially for those still unvaccinated and children younger than 12, as the pandemic is not over yet. KTTC's Sarah Gannon joins us live in the studio with details on a new state effort to help those in disadvantaged parts of the state. Sarah.
And Caitlin, there is still plenty of virus out there in our communities, and many Minnesotans remain unvaccinated because they are either not eligible yet or in disadvantaged areas.
We're now at about 61% of those over 16 with at least one dose and over 88% of those over 65.
As the number of vaccinated Minnesotans continues to climb, the ability to dial back on COVID-19 restrictions is possible.
This is a sign of the progress that has been made in vaccinating Americans and Minnesotans, and really especially a strong endorsement in the effectiveness of the vaccines.
But health experts warn to be cautious as there are still several unvaccinated Minnesotans.
When in doubt, wearing a mask is always a good idea. Regardless of how anyone may personally feel about the risks, we owe it to all those Minnesota children under 12 and others who have not yet had the chance to be vaccinated to do the right things to prevent COVID transmission.
And in an effort to continue getting the vaccine into disadvantaged parts of the state, MDH and Minnesota Department of Human Services are partnering with Minnesota health plans to improve COVID-19 vaccine equity and access.
Starting next week, the organizations will work together to identify Minnesotans who have been most impacted by COVID-19 and continue to face barriers to getting vaccinated to connect them with vaccination opportunities. The partnership program will work to reach Minnesotans enrolled in Minnesota healthcare programs such as medical assistance or MA, Minnesota's version of Medicaid, and Minnesota Care, who live in high SBI zip codes and have not yet been vaccinated for COVID-19.
The health plans will work together with the state to contact members and provide vaccination information, assist with scheduling appointments, and help with transportation if needed. Anyone who still has questions or are concerned about getting vaccinated are asked to contact their healthcare provider. Tom and Caitlin, back to you.
All right, and also